Okay, so thank you for joining us. We only put a couple of announcements out about this biannual update, so we'll rattle through it. And the importance of this update is to get Q&A and feedback and questions and input. So we'll share the recording for those that haven't made it tonight, and we'll anticipate seeing what you have to say and taking it on board. So I've got a presentation, whether I can find it, there we go. So yeah, the intention of tonight is to go through PHA's roadmap to date. So for 2026 to date, what we've achieved so far, and then where we're going for the remainder of 2026, and
So let's have a look.
how people can get involved. And as I said, the priority is getting feedback from this event. It's not about actually presenting, it's about letting you know what we're doing, where we've got to, where we're going, and asking you to engage with us and tell us your thoughts, ideas, feedback, questions. So we'll give the link for that as well. So our impact is entirely powered by how you get involved with us. There's no point in us being here if you're not, so we need you to show up. So from our community, this is a quote from Nikita Stark, our pregnancy and birth ambassador. I'm incredibly proud to be part of PHA. It empowers people to take control of their health rather than passively receiving care. The harm caused when people give away their power is profound and often avoidable. So that's one of the many reasons that we're here, and that's just one quote from a lot of people that have given their feedback on why they engage with PHA. So our mission, we've had an update, is to empower 10 million people to take back control of their health. And that's not a nice round number. It's actually the tipping point between 7 and 10 million people in the UK is the tipping point of collective consciousness to kind of shift the narrative around what is normal across the country. So we're hoping to achieve a paradigm shift around that goal. The pathway to that we've created is enabling everybody to find the support that they need within a couple of clicks on finding the website. So we've redesigned the digital journey, when they find us, what they see, what they read, what they feel, and where they go from wherever they actually join us in the website. So at whatever stage they're at. So that journey is intended to take them through to joining the village, which is intentional to bring people together so that they can connect locally. So it's a journey that's online because people search for information online. It's to find PHA, work out where they want to get involved, because there's a lot that we're doing. There's different pathways that I'll show you in a minute across the website. And as part of that journey, to join the village, connect with people, find your local kind of tribe, and take action offline. That's the whole point of what we're doing. It's nice to have like an online community, but it's kind of superficial connection online. We want people to actually connect locally offline and create connection and resilience. So that's the pathway for people. This isn't scrolling for some reason. There we go. So our model is fiercely independent. So we intentionally avoid government, corporate and special interest funding. We rely entirely on our donors and fundraisers and other ways of creating income around the workshops that we do, and a small amount of affiliate stuff that we share. So we spend every penny wisely with one goal, which is to reach more people with unobstructed pathways to health and well-being. And we do that by keeping everything that we do is free. and then we also create opportunities for people to donate for like value added things that we do. So like the Christmas promotion that we did last year was all available for free, but we'll bring it together as a kind of in an accessible way for people that want to donate to PHA for the added value that we wrap into that. But everything that we do at that point, a point of kind of access to the information that we put out on the web, is free. So what did we do in Q1? So January to March, we were looking at designing the pathways into PHA. So we restructured the user journeys. So this is all about stuff that we're about to launch. So people see a new experience of PHA when they come online. So we've developed new user journeys so that everybody finds the support that they need within a couple of clicks. The project team now have like a knowledge base. We work on a collaboration platform that gives us, I say, easy access to the information they need, but everybody else kind of struggles to find it. Needs to do a bit more training around that. We've started to introduce case studies around health sovereignty, where we're asking people to write into us to share their experience to empower and motivate other people to take action with their own health. And we've recruited a practitioner ambassador to strengthen relationships with our practitioners. As we move forward, we want to encourage more practitioners to sign up to the practitioner directory. And we've supported 105 inbound community success emails. So every single one of those emails gets personal connection and support. So these things that I'm mentioning here are just like the highlights. There's a load of stuff behind this that we've worked through in this quarter and each quarter that I'm going to discuss. But these are kind of the top level highlights of what we've been doing. So moving into Q2, which is April to June, it looks like opening the doors to people. So we've launched a village founder kind of sign up list where people can sign up to be our beta testers when we launch the stuff that I'm going to show. Because we're developing stuff in the background, but we need people's input and feedback to make sure that we're actually creating the experience that people want. So we're all ears, we'll take any feedback. The People's Community Network meetings started to connect people to come together and actually talk about how we're going to create the change locally. Those are our kind of action takers that come together to discuss the things that we're doing to bring people together. We launched National Community Week, which is mobilising groups across the country to think about what community means to them and bring people together and look out for each other. And we started an initiative for compassionate care in the community. So we have a page dedicated to care, and I'll talk about the current campaign around that. And we dealt with another 117 community success emails. So every person was guided to the next step through our volunteers. So the primary pathway that we're setting up is the village. So we have a brand new website experience, and the whole point of that is to take people into our online forum, our community, which we're lovingly calling the village, which is an oxymoron because it's kind of global. It's going that way. So it's to bring people together in a way that people feel connected to do things at a local level offline. So it's more secure and organised than you would experience on social media, where you have to fight with algorithms and kind of interference going on there. And yeah, we need people's input to ensure that we're building it in a way that we've kind of formulated it in a way that we think reflects PHA, but we need to ensure that we're looking after the people that actually want to use it. So we want people to actually build it with us. So that's the first half of the year. So 222 people personally supported and signposted. Every single email is answered by a real person, and every person is guided to the next step. So on to where we're going from here onwards. So just for full transparency, the financial reality is that monthly costs currently exceed our income, and your donations sustain PHA while we work on the things that we're currently working on. So I'll go through, kind of walk through the website and the packages that we're offering that will create sustainable income ongoing, but at the moment we're very, very dependent on donors. And we did receive, thank you, hand on heart, thank you so much for the people who donated when we shared the stuff that we're doing around care. We did see an uplift in donations, and they've made a difference for us. So thank you. But if everybody that reads our newsletter donated just £1 to £2 a month, that would literally secure PHA's future in a fair and distributed way. So
I think, Saz, at this point, it's probably important to just note how much funding we've got left in the pot, and it's probably only 3 or 4 months worth at the rate we're going, exceeding costs over income. So, we've come so far in 4.5 years. It'd be an absolute travesty if we had to sort of just stop progressing. We're moving forward at a great pace now. We've spent 4 years building on this, and if we had to go stagnant for a while, I think that we're all going to miss out on a lot of great stuff that's in the pipeline.
Definitely. Well, I've got the link somewhere, but does anybody want to share the donation link in the chat? Oh, it'll go out with. Sorry, there's only a few people on the call. We'll make sure that the donation link goes out with the
The
update.
recording.
I think it will go in the news updates, won't it, on the website? So looking ahead for Q3, the pathway for scaling in a way that is resourced. So the pathway that we're putting in place is to open up the village after the beta testers have gone through the process of giving us our feedback and using it and showing us where it might break a little bit. We'll make sure that it's fully operational and put it out for general rollout. So we'll need moderators. There's local spaces that map onto current Telegram groups, which are being inundated with spam at the minute. So we encourage the owners of those Telegram groups to come into the local spaces that are created for you. They map onto Telegram groups, so you can come in and claim those spaces, and there'll be curated resources that go in there. Mags?
Yeah.
Question?
Explain what the village is.
Oh,
That's a good question.
yeah, the community forum. So it's PHA's it's the PHA's online community that's structured in a way. I'm going to go through it, screen share, so show the website and the community forum. But just to say now, it's the online structured place that enables more productive conversation by creating the spaces that enable that rather than the kind of chaos of social media. But I'll go through screen share.
It's a private space.
Oh yeah, private, more secure space. For the Care in the Community initiative, we have a campaign for the Hand That Stays, expanding community care for vulnerable, not just our members, but across the UK. we've launched, well, Kerry has launched the Feel Good Fix with Kerry and Mo, so connecting people with mental wellbeing support. And we have almost ready to go the manifesto, playbook, and local blueprint. So these are things that are shareable across our digital infrastructure to enable more people to gain insight into clear insight into what PHA are and what they're doing and how they can get involved. And then I think Gio is going to touch on shortly a community support program for vulnerable communities with PHA's partner, My Medical Choice. And in Q4, we're moving into deepening those connections. So we'll be creating more along the lines of what we did last year with the seasonal promotion, which is creating also all of the stuff that we publish. We'll create a value add offer to bring all of that together in an accessible place. We're going to double down on finding these incredible practitioners to populate our practitioner directory with root cause approaches to health. And to bring the kind of the new offering that we have to more people, we'll be running a wellbeing summit that asks our ambassadors to share their breadth and depth of knowledge to more people, to bring more people into us. And then we're also having discussions with our global kind of chapters, partners, what do we call them? Family.
PHA family.
The PHA family, to double down on these issues aren't just happening in the UK, they're happening globally. And then we'll be looking at, we've looked at key things that are our actual, the ways that we actually impact. So we do lots of stuff, but what are the key things that actually make an impact? So we'll be reporting on what that is. So together we're building something extraordinary, and we want you to join, be a part of it, join the village. And at this stage, it's about helping to design what it is as we move forward. So if you sign up as a village founder, you'll kind of have a little badge to say that you were a founder, and you'll be able to give us very direct feedback on that. So, Stuart, should we do any questions here before I go into screen sharing? Screen sharing.
Saz, I was just wondering, a link somewhere. We talked about our financial status at the moment. People might be wondering what we're spending the money on that's coming in. So is there a link to click up where we show our expenditure?
There is a donor report that's about to go out to the people that donate.
Because I don't think we realise, like website costs, server costs, etc., etc. And so I think it's good to be transparent.
Yeah.
Yep.
So there's a donor report that's just about to go out. I think Lisa was looking at kind of a graph of the details as to where that spending has been, but it is literally just about to go out the door.
Great, thank you.
So, yeah. Any other questions? Just up to here? No?
How was it August already?
Everyone's
Good
gone.
question.
What happened to July? I don't understand.
I know, it just went like that, didn't it?
Yeah, I can't believe it.
And June, actually. June and July just gone.
In a haze of sunshine, eh, Max, down here?
It's a haze of grey and drizzle in Manchester.
Is it?
Mm-hmm.
It is at the
We need a
moment.
bit of drizzle down here because we need watering.
I
And we've
think
got hose pipe bans, so it's like I have to carry a big bucket of water to water my potatoes. which
Oh,
is
but
probably very good exercise for somebody who sits in a chair developing all day.
I think there's a loophole, isn't there? If you've planted something new, you apparently have 28 days that you can water them for.
Oh,
Something like that.
really?
Yeah.
Not with Thames Water, no. They've got their little spy cameras and spy drones all over the
Oh,
place.
really? I was just wondering how they're policing that, but I guess drones, yeah.
What about all their leaks and anyway, we won't go into that, shall we?
No,
Moving on.
it's not.
No, let's continue.
Right, so this is our new website that is, how close are we, Mags?
Yeah, how close are we? We're very close,
We're
darling.
very close, yeah. So we just need a bit of testing and tweaking, and then we'll be talking about putting this out. So our new messaging is basically this. So it's healing doesn't come from a pill, and it's about taking back control of your health. So the including the word back in there is intended to speak to the people that are kind of very actively, we want to take this back, but kind of still speaking to people that might not necessarily, be that adamant that it's about taking something back. But it's very, very about this. It's about empowerment and connection for autonomous thinkers, people that want health sovereignty and do want to take back control of their health. So we've just explained the experience that people might have had to date and where they find themselves here. And just a touch to say that we are very, very lovely people. So come and get involved with us. And then there's a pathway in to just start here, and that takes you to what the village is all about. Or we can go in through the 21-day health reset, which takes you into the village in a shared experience. So you can either do it's the health optimization program that's on the existing website. So you can still go there and kind of pick and mix the things that you want to introduce into your own health routine, or you can actually go into the village and do it as a shared experience and share the things that you're doing and the benefits that it's having on your health. We're sharing our ambassadors as the visionary leaders that are stepping up to lead this conversation. And we're talking about what it is that really makes us sick. So this is the problem. Doesn't speak very specifically about specific things, but kind of talks about, these very points to the people. So if they know what these things are, they know what it is that we're talking about without naming them explicitly. This is the solution, which is a global movement for change. This is where we're currently at. We've got 6 global chapters and we'd welcome more. The community groups that we have and current followers. And this is our promise. So it's to make healthcare personal, life-changing and accessible to everybody. And this is how we go about doing it. So it's community who ask questions and value open dialogue. We lean into practitioner wisdom and no one's alone. And then it goes into our mission here, which will point to a manifesto that people can share. And then we talk about our impact, which are the results. And then our mantra is about building grassroots health, not globalist wealth. So there is a route in for everybody that comes to the website, and then there is a route in for our practitioners to discover the directory. And then we just kind of pepper in some examples of the practitioner directory and some posts. So if I go, I'm just going to go straight up to the top, up to the menu. So we had lots of stuff across the website, loads of really good initiatives that were kind of buried in the website. So we brought them right up to the top and put them here. So we've got the care Care in the Community, our partner My Medical Choice, which is where Gio spends a lot of his time, the Health Reset, the workshops that we do, the Connect the Dots, which is about marrying up the local groups with the across the country and with our practitioners, and the mental wellbeing and some detox initiatives. So if we're going through practitioners, we're talking about being natural, holistic first. I think we'll just go in there, search the directory. So we've got this new beautifully designed directory, which enables really clear searching of the practitioners are in there. So from here you can flick between practitioners and community groups. You can search by health concern or keyword. You can search by the therapy type. We've got, I think it's 24, 25 therapies in there. But not everybody knows what it is that they're looking for, so you can just kind of talk about the issues that you're experiencing. You can search by your location. I'll get out of that now. Use current location. Put me in there.
By postcode, which is our new feature. So you can just put your postcode in and it works. I'm very proud of it because it took me, I don't know, about 4 days to work it out.
And then you can kind of zone in on the kind of mileage that you want to look at. You can choose in-person, online, home visits, and it responds to what you're looking for. And you can look for accessibility.
And also by condition.
And that, hang on, get rid of all of that.
Very important by condition. Because
that's it,
there was a practitioner that approached us and said, basically, all well and good to have a list of modalities.
Yeah.
It's great for us that know what a modality is, but somebody who's coming to the website for the first time, who has a back problem, for example, or feels anxious, our search form isn't helping them at all.
Mm-hmm.
They're supposed to know that whatever modality is going to help them. They have no clue. So she mentioned that maybe put in something that where they can type in their condition or their concern and do a search that way. And we've done that. That's a huge departure from every other website that does a similar kind of directory, is that we are focusing on the conditions. Not that we are treating them, but we are listing practitioners that cite particular conditions that they may be able to help with.
Yeah. And basically all around restoring health. So we're not dealing in disease, we're dealing in restoring health. Or you can go in through the map and look at your local area and drill down into what's local
So if you
to you.
show, for example, type in anxiety and it will show up a whole list of practitioners who deal with that. But not in Wilmslow, because you're still in your local. Oh, there you go. There are a few.
It's an epidemic. And so with the listings that is being developed currently, I did have the new listing. I'll go into that in a bit. And so the local groups, similar. You can find local groups near you. So it's a very similar display. And then where community groups and practitioners come together, the groups can link the relevant practitioners to their community group. So that can either be to existing community groups, or if practitioners come together to build a local network, then they can create a group and link all of their practitioners in there. In the resources, We've rather than being format based, these are all now kind of need based. So the things that people would search on based on that. And then we also have this new section called Hidden in Plain Sight, which is for basically crowdsourcing people's experience to acknowledge what people are experiencing and for people to understand that we know what's occurring in the world. And we don't talk about this stuff, we talk about the solution. But if people intuitively go here and start to click, they'll start to create a web of a picture as to
What's really going on?
what that story is for themselves without us, having to go into it. But also while they're in there, it's kind of they're surrounded by the solution rather than more problems. I've spoken about the pathways, and so why did I have that? Oh yeah, so we have a wider conversation with our international family, and we have we can have pages, landing pages. Are they called, Max? Like
They
landing
are called that,
pages.
yeah. Yeah.
So people can find our international family through our website. We're having other discussions, but right now this is a way for people to find our international partners. So they can have a contact form on there, and we can also look at putting specific donations for to enable the growth of their local area as well. So I think that's why I had that up there. If there's any feedback for us around any of this, I thought I brought the page up for. That's where you can write to us, the PHA/hello. We're all ears. And then going from the website. So if you go through the structure of the village. Oh, I didn't go to the pages, did I? Max, you need to tell me off. No, sign up. That's where I was going to go. So sign up. Okay, so this is the experience that the practitioners will have. So it's all about having a movement behind our practitioners and joining an ecosystem for visibility to make the services easier to find. So I'm just going to scroll through this because I'm looking at the time, but anybody can pause and look at this, what the new website looks at. Shows what you get access to by being a practitioner with PHA. Explains what the alliance is. We're not a governing or licensing body. We're a community of people that are behind our practitioners. What you can expect when you come into the village, and some testimonials of why people stay with the PHA and the things that we actually do to support our practitioners. And then the packages. So you can come in as a monthly or an annual. So there's different things wrapped into the packages for a starter package or a visibility package. There's things that we'll do to enable more visibility, and then there's a professional package, which is more for like the people that want to take speaker spots or have an opportunity to be a PHA ambassador and things like that. And then we're also opening up the opportunity for like established clinics or practices to join us as well. But having said all of that, if there are people who are at the beginning of their practitioner journey or right at the end of their practitioner journey where they don't necessarily have the income to support joining us, we'll have a conversation about volunteering that might be maybe in the village or supporting the admin side of what we do. So that's the practitioner journey, and then the online community. Again, I'm just going to scroll through it because you can pause it when you watch the replay. Just showing who we are, what we do, and how we do it.
Those are clickable, by the way.
These.
Yeah.
Wow.
I just did that today. Yeah, so they're clickable links
So
to
it goes through to the directory.
To the directory, yeah.
Yeah. So we're creating a village feel that is kind of no pressure, just kind of come in, make connections, learn things, and make your local connections to take things offline and build what you want, build the real things that you want in the world in your local community. So this is just in the midst of being built, isn't it, Mags? So
yeah,
there's a bit further to
it's
go
not
down.
ready yet, Carl. It's not ready yet. We're still working on it, tweaking it, and yeah, it's quite mind-numbing.
And so the community, right? So this is where we're going. So this is our online community, which we need feedback on. We've kind of put the bones in for people to come and experience with us. This is me and Mags messing around testing, so ignore all of that. So we've got a village hall, which is kind of all the admin and formal stuff, announcements and whatnot. Then we've got learning spaces, which is split between an offer, so it's free for anybody to join PHA, but we're also putting an offer in there for people that want to support with a monthly donation, and they'll get some extra bits and pieces around, like when people have been interviewed, they'll be able to ask questions and then direct contact with some practitioners that are going to hang out with us. There's a section dedicated to building these resilient networks, where the monthly network calls. Sorry, Lisa, what are they called?
Say that again.
The network called the
People's
PCN.
Community Network.
Yeah, I'll update that. So there's a course in there around using the directories, which goes into connect the dots and all of that, local building local networks. Getting tongue-tied.
It's also about helping the practitioners to optimize their listings to make them more effective. So because we rely on people searching for stuff on the internet, so it's important that we help the practitioners to optimize their listing so that they will come up in a search, basically.
Mm-hmm.
Stuff like that. We have to deal with the other side, unfortunately.
So this bit, the Verified Practitioners Lounge, this is where we're delivering those packages to whatever practitioners have chosen to opt in for. Anybody can come in here, but if practitioners are sharing expertise that aren't a PHA practitioner, they won't have their verified check mark to show that they're part of the movement and mission statement. And rolled into these packages will be some coaching around optimizing your listing and things like that for visibility. And then we've got spaces in here for wider conversations. So we've got the care conversation and the youth education and food freedom. So that's a really whistle-stop tour, and I've taken probably half an hour to go through it. So this care section is what we've launched with the Compassionate Care in the Community and the Hand That Stays campaign. So I think Lisa's going to talk about that, and then Gio is going to mention the community initiative for My Medical Choice as well. So shall I stop sharing my screen? Oh, that's what I was going to share. So if you'd like to become a village founder, you can go to the PHA website, the pha.org, and just do / village dash founders, and you'll get this form, and you can join the list to come and hang out with us. There we go. I'm just going to go on mute because okay, so I think Lisa, do you want to share about the hand that stays?
Yeah, can do. So probably 3.5 years ago now, we started looking at care for the elderly and vulnerable in our communities as a priority, to be honest. It's something that affects us all, and we felt very strongly about that. So we created a group 3.5 years ago. We spent quite a lot of time pulling together information to help people navigate this system.
Lise, you're on mute.
I'm muted, and I was just saying some great stuff. I'm going to have to do it all again now. So the hand that stays. This is our community care, compassionate community care initiative, and this journey started probably 3.5 years ago when we were about a year into PHA, and it was something that a number of us felt very strongly about in terms of the real issues impacting people in their communities. So it's been a work in progress for a long time, and the reason that it's taken us this long really to start feeding this out and getting feedback and bringing people on board is unfortunately back down to that word money, and we just haven't had the resources to be able to progress it as we would like. But that's because other things took precedent. Now I think timing is everything, and the time is now, and this needs to come out because you know care in the community is such a huge issue. We have a care system that has collapsed. It's not collapsing, it's collapsed. We have private care, which is not affordable. It's all profit driven. And somewhere in the middle, there needs to be a solution for us to help the elderly and the vulnerable in our communities. And that is the word, it's community. The solution is community. So that's what the hand that stays is about. It's not going anywhere, but it's all down to us. So I hope that people will get behind this initiative. It's I think, like I was talking to myself on mute, this affects us all at some point or another, whether it's a family member, whether it's ourselves. And there's two sides to the system that is failing us. In between, we are the glue that can help care for people, and in turn they will care for us. But we have to start somewhere, and this is where it starts, with the hand that stays. So please visit the website, have a look at it. I think under get involved, you'll see a drop down there. We're only starting this week to feed this out slowly onto social media, but that's because we're waiting for the village, and we're all very excited about the village because that gives us a place to bring people together that really care about this topic. And we can bring them together in the village and start to look at those solutions. And again, this is, I think Saz raised it before, these are global issues that we're addressing: mental health, isolation, loneliness. These are the real pandemics, and these are the things that we need to address globally with a global team. And we're looking for global solutions. So the village really fits the bill for bringing everybody together in that place to get working on this. That's the hand that stays.
Super, thank you. Gio, do you want to share?
Hello. Yeah, building on everything everyone said here. Obviously, you can see the heading, the way PHA is going, and we're about health. We're about looking after one another, supporting each other. And one thing we've done, PHA, is we've partnered with MMC. Now, I'm not going to talk about what MMC does, as in the medical autonomy or all that. It's not going to be about that. What I'm going to do, if I can share this,
MMC being my medical choice.
yeah. Um, what we've done is with my medical choice. Now, this is not live yet, so you're getting a sneak peek here. Um, right, you can see this page. This is going to be one of the pages that PHA and my medical choice are going to do. We've taken it upon ourselves to try and help at the moment up to 1,000 people in the country. That's in communities, local communities, maybe in charities, the most vulnerable. Now, this goes hand in hand with the other project at the PHA we're working on. So what we're going to do, this is going to go live. So this isn't yet on the My Medical Choice website. This is going to be probably another week, but this is what going to be what it looks like. So this is a part of the page. I don't know if it'll let me scroll to the next bit. I'm not sure if I can do this. Let me just see. So yeah, all I've done is grab screenshots of the page. So we're going to do like a free for life membership for the most vulnerable people within communities because we must help them. We know what's going on. And a lot of times, a lot of these people are alone. They're struggling and they could be at home, but the communities know who they are more than we do, the PHA. So communities will reach out to us and they will email or get in touch, which however they want to, they can even call. We're going to do this with PHA and My Medical Choice. And slowly across the country, we're going to roll this out so that, as I said, at the moment, it'll be 1,000 free. This will be for free, by the way. We're going to give this away. People can have protection. So if something happens, the reason this is we don't believe that anyone should be forgotten. At the end of the day, if something happens, if somebody's on their own and they can have this in place, they've got their medical details there. They've got the system automatically emails their loved ones. So if they fall, let's say in the street or somewhere, and the first responders find them, they scan the card, standard procedure. It automatically notifies the loved one. So these people are never alone. So what we're trying to do is help with the aid of the other projects within the PHA, which is as Lisa was talking about, the hand that feeds. If we can get this out, first of all, to 1,000, it sounds like a lot, and it is, but gradually we're going to reach out to different communities, then we're going to keep building and building on that. This is basically what the donations people give us allows us to achieve. We can do this. We've been able to start this project because of everyone that's helped us so far. So it's not PHA doing this really, it's all of you. Even you're probably not going to get to meet the people who it's helping, but you're going to know, you can rest assured that there's people all over the country that are getting some kind of help and we're giving that to them. And this is only happening because everyone in the community as a family has helped us achieve this. So this is where we're going. Sorry, Max, you got your hand up there, mate.
No, just to say, maybe explain in a nutshell what MOC is about, because you're coming into assuming that everybody understands MMC, but they probably won't if they listen to
No,
this.
I've probably not
So
done that.
it's worth just in a
I'll
nutshell, what
yeah,
is MMC?
I'll skim it because this isn't really about that. It's more, yeah, about the other thing. But basically, it's for those that haven't heard it, it's a secure system that helps keep important medical information, emergency contacts, treatment wishes. Let's say certain people might not want mRNA treatments or other things, but it keeps all this in one secure place. And this isn't on the NHS servers, by the way, where data can accidentally get misplaced, as they say. Um, so, in the event of an emergency, your loved ones are notified. If you're unable to communicate, it's like your voice. Let's say you passed out, you can't communicate. It's your voice, so it allows while you can't talk, it's your voice for you. So, and we're all aware as well. One thing close to me is I'm quite aware of how they've placed DNRs in hospitals on elderly, vulnerable people without telling anyone. And we've seen this. It's been, it goes on, unfortunately, but it doesn't go on in every hospital. So what we've done in this system, we've actually put a clause in it that specifies they cannot put a DNR on you without first notifying your loved ones, the health welfare who are dealing with you, the health welfare team, your family, or yourself if you're awake. So basically, the idea is designed to give you and your loved ones a greater reassurance and peace of mind. It does a lot
DNR.
more.
What is the DNR?
Do not resuscitate. It does a lot more than that, but I'm not going to go into all the bits it does now. I've saved that for another when we do another update or something. This is mainly about where the PHA is going, what we're progressing into. And as I said, because of everything you guys have done, it's allowed this slowly now to come into fruition. And we're bringing this in, which is an amazing thing, whether it's the community side is brilliant or this, if we can help people, the most vulnerable in society, and we can give this for free,
It's
that's it.
fantastic.
Goal achieved. That'd be so happy that that we've done that. And it's not us, PHA, it's all of us as a family, as a community that have done that. We could
Can
have done
we
this.
perhaps share the My Medical Choice website in the thanks, Keza. Because then people can go and find out more about My Medical Choice and the amazing services that it provides.
Yeah, but this side of it basically is going to be coming soon, and with the aid of PHA together, we're working on this. So you've allowed us to roll this out. I couldn't be more grateful to everyone, all our followers and members, the family, because this is so important. Obviously, I've got a brother who's mentally disabled. We all know people who are mentally vulnerable, physically vulnerable, and if we can help them, that means so much. And we've done this together as a team. Not meaning us, meaning us, as in you collect the entire PHA members, everyone. So thank you to everyone. I'm so grateful, and I'll pass it back over to you, Saz.
Thank you. Kerry, do you want to talk about Kerry and Mo?
Yeah. Sounds funny, doesn't it?
Do you want me to share your event on the?
Yeah, please do.
Hang on.
Put it in the link. I can put the link in as well.
There you go. Hang on.
It's a much greater picture than looking at me. So it should be called Mo and Kerry, but Maureen insisted it went the other way around and alphabetically. But
Why don't you do Como?
Chemo. Oh no.
No, we won't do that one.
Oh dear. That's like a club. Anyway, so this is all about mental well-being. So yeah, laughter is great. So the lovely Maureen Fearon, our mental well-being ambassador, has kindly agreed that every Tuesday we will be what's the word? Having a new topic that she will talk about and advise upon regarding mental well-being last week. And the irony of this is I couldn't remember what we did, and it was about memory. So that was quite funny. And also a couple of my friends forgot to come. but it was great, because she shared tips on how to improve memory, and if you think you may have had a diagnosis that isn't true, with a cognitive decline, Maureen shares some tips on how to improve your memory. So every week we're going to be covering a topic. Next week we've got Forget Your Fears, which is going to be great. And as I said before, Maureen is the expert. I'm just hosting. But we welcome feedback. And if there's anything you'd like us to cover, please do so. We've got about 4 recordings in the bag already. So if we can't make something live, then we will share a recording. But as we plan, it's going to be every Tuesday. So please join us if you can. I've put the link in the chat and look out on social media.
Yeah, and it's also available on the website under resources tab and events calendar here. So you go there and you see upcoming events and it's here.
And thank you to Mags and Saz for helping me put it on the events page. Trial and error.
Yeah, but I've showed you how to do it, so you can do it yourself now.
Okay, so thanks, Kerry. So just to wind up, 2 minutes past 8. if you want to review the roadmap, you can go here, the pha.org/roadmap, and that goes through to our platform that we work on. You can see the roadmap and the progress notes where we're up to. If you would like to become a village founder, get early access and help us build it, you can go to here. Put
Oh,
/
you're already a
village,
member, mate.
village founders. Oh yeah, he is, isn't he? If you would like to write to us and give us some feedback, you can go to the PHA /hello. I think that's it. I think that's everything. Yeah. Yeah. So those are what we would like to ask. If you can look at the roadmap where we're going, join us in the village as a village founder and write to us. It's just the PHA /hello, and we would love to hear from you. Thank you, everybody. Shall we stop recording?
Do you want to ask if anybody's got any questions just before you sign off? Just anyone here?
Not a question, but just to say that I'm blown away by the amount of work that you guys have put into this. Really, really excellent. I mean, I'm just, yeah, really excited and glad to be a part of it. Thanks.
Thanks, Gar. We're excited too.
We love you too, Gar.
And I don't know why Mags can do that and nobody else can.
I've been reactioning all over the place.
I don't
I sent Kerry some elephants about a memory.
There you go.
Yeah, I can click the button, but I can't gesture and get fireworks like Max can.
I always start my Zooms with everybody. Get onto the chat, introduce yourselves, and press your reaction button because it's fun.
Yeah.
That's it.
Oh, my whole
Come
screen.
on, Cecilia, come on, give us a reaction. Anne, give us a reaction.
Monique.
It's at the bottom, on the bottom row, you'll see reaction. It's fun. Max's face, he's having fun.
Oh, we've got a heart from Celia. There we go.
Oh, well done. Yeah, I like reaction.
Sorry, I'm on my phone. I can't find the button. But woo! Well done, everyone.
Oh,
Oh, my son agrees.
We can't even see you.
No, I'm having a very bad hair day.
is that Monique?
Yeah.
It is. Yes. Hi.
Hello, Monique.
Hi, y'all. Hi. I'm listening in, but I'm multitasking as well. But yeah, I'm happy to have a look at the website as well. If you want anyone else to, I'm good at proofreading.
Oh, brilliant. Could do with a proofreader.
Yeah.
Amazing.
Let me know if you need any help anyway.
Great.
Thank you.
You know, we always need help.
Indeed.
Always.
I'm doing my little bit. I've added, like on my harmonyhearts.org website, I've added like a clickable link to the PHA website.
Oh, brilliant. Thank you.
That's okay. Easily doable.
Wow. Every little helps, doesn't it?
Absolutely.
Sure does.
So
Monique,
we just
do you have a listing on our directory?
I don't at the moment because I'm not really a practitioner. I was a practitioner, helping the non-speakers, but I'm not doing that anymore because I'm going in a different direction. I'm more focused now on creating a hub for the autistic non-speakers and their families. So that's what we are currently
So you
working
can create
on.
a website for that on our community group directory?
Okay, that's cool.
Yeah, you can do
Okay.
that.
I was
I'll
thinking it
help
was
you
like,
do it as well. I
And then
can
we
help
can
you.
feature you.
oh,
We
perfect.
can do a spotlight.
Okay,
We
no
can
worries.
promote it.
Yeah,
We can
we'll do
promote
that.
it as well. Yeah, we can promote it as well. So it's worth
Yeah.
doing. Worth doing.
Okay. Yeah, we'll do.
Send us an email or a hello at or whatever it was. What was it?
Hello, PHA.org.
You know the one. Yeah.
Forward slash the-pha.org forward
Yeah. Our
slash
URL and
hello.
then slash hello. Yeah.
Right.
Chat, Mags.
What?
Put it in the chat.
Oh,
So,
Don just arrived. He just missed the meeting, but he's just only just turned up.
Cecilia, I'm interested in starting a group in the West Midlands. Great.
Brilliant.
So we can, for any kind of non-profit community focused groups, there's a free page available on the group directory. And then if you've got any events or anything like that, if you've got a group on the website, we can start to list your events on the site and then share it in the village. Get things moving.
yeah.
Super.
And if you want any help, Cecilia, just drop us a message at hello at, and
It's in the chat.
yeah, the-pha.org/hello.
Could I just ask, Monique, are you still there?
yes, I'm still here.
Okay. How can I get in touch with you?
Oh, well, you can email me at hello@harmonyhearts.org.
Okay, thanks.
No worries.
There you go. Connection made. Job done.
What is that?
It's all about connection.
100%.
Okay, so shall we wind up if there's no more?
Yeah, is there any way,
Questions?
Saz, that I don't know if we're still recording, but for people listening to the recording, if they've got questions, is that best to go through hello or
Yeah, that's why I shared. So the three things to go and look at are /roadmap, /village-founders, and /hello. So if there's anything you want to write to us with, go to /hello.
and perhaps just maybe depending on what comes in, if there's a lot of Q&A, we could record a Q&A session
Yeah.
to answer some of these questions in a bit more detail than perhaps just returning an email or something, which is a bit impersonal, isn't it?
Yeah.
Good plan. Good plan, Lisa.
Good plan, man. Thanks, Como.
Okay, I'm going to stop recording.
On that
Bye.
note.
Bye.